I am the OET course leader at Khaira Education. We're going to be sharing some speaking tips with you on our Facebook page every week. Today's topic is demonstrating courtesy towards your patient. This will help you to improve your score in the clinical communication criteria, especially the criteria relationship building, which assesses a respectful and sensitive attitude towards your patient. So I hope you find this useful, and if you're planning to take the exam, if you're a doctor, if you're a pharmacist, a physiotherapist, or a nurse, or a dentist planning to take the exam, please get in touch with us and we'll help you to pass your exam.
Relationship building. One of the sub criteria there is to demonstrate a respectful attitude towards the patient. And let's discuss some courteous phrases, some words that reflect common courtesy, because this will help to keep your interactions with the patient respectful, and they will also improve rapport, and it will improve in establishing a positive relationship with the patient. The first activity that we'll do is, let's look at these three examples. They are the kind of responses that you should avoid in your OET speaking, and we're going to transform them into more courteous, more respectful, more polite responses. The first sentence is, you will need to wait to see the doctor. Now, this is very direct. I feel like this is too blunt, and it can be transformed into a more polite response. Something like, if it's okay with you, can you please wait for some more time? Or if you don't mind, can you wait for some time to see the doctor? And it's not just essentially to see the doctor. Any task for which the patient has to wait, it could be a medical procedure, it could be to wait to see another professional in the hospital, anything that you're asking the patient to wait for. Obviously, waiting is not something that's going to be comfortable for the patient. In a high pressure environment, it can aggravate the feelings. It can be slightly uncomfortable for the patient. So your response needs to reflect that you acknowledge that this is something that will be inconveniencing the patient, but it's not, you cannot really help them in this case, and that you understand the discomfort involved, and you're politely requesting them to do so. So another example could be, would you please mind waiting for a few more minutes? You could also come up with some reason like, the doctor is attending to a critical patient right now. I apologize for the inconvenience that this is causing you, and I assure you it's not going to take longer than a few minutes. So something that sounds polite to hear, that's more pleasant, rather than hearing a very direct response like this. Now, let's see the second one. I do not know. Sometimes you may be asked questions to which you not know the answer of. You may not know the answer of something about the patient's treatment, or about the diagnosis, or anything really which is not within the scope of your practice. So in that case, rather than saying, oh, I don't know the answer to that, I don't know about that, you could again make it more polite. Say something like, I'm afraid I don't know the answer to that at the moment, but please allow me some time to find that out for you. Or, let me find an answer for you and then get back to you. Let's see the third one. I can't help you with this. I'm sorry, I can't do anything regarding this. Let's assume that in a role play, a patient shares some problem of theirs. Something like, oh, they're too busy and they cannot really make the changes that you're asking or advising them. And rather than responding courtly with something like this, so, oh, that's not my problem, I can't help you, I would suggest softening that. Example could be something like, I understand it's going to be difficult, however, we need to consider, and then you could give your own reasoning. Or if it's again something that you don't know the answer to, you could say, I'm afraid it's not within the scope of my practice right now to answer this, but allow me a moment. I will ask somebody, I'll ask the qualified personnel, and they will get back to you regarding this. So it could be any situation. It's just what we're trying to establish here is that you need to be courteous in your language. I've put together a list of some basics, some courteous words and some phrases that you can use. They can be used in a conversation, and they just demonstrate respect towards the patient. Now, the first one is please. Don't forget to say please. I think even when you're asking patient in some information on the patient, probing into someone's life and not sounding polite or not sounding respectful just seems rude. So you could use this word when asking or inquiring about the patient's lifestyle, or perhaps when you are trying to persuade them to consider something, to reflect on something. So an example can be, could you please tell me something about your dietary habits, or could you please share details about anything that you want to ask them. But just adding the word please, it will make a huge impact. The next one is thank you. So when the patient answers your questions and shares their personal information or some sensitive information with you, say thank you. Thank you for answering my questions, or thank you for agreeing with me. The next one is sorry. Now, if your patient is angry or agitated about something, if they have an emotional reaction, it's just courteous to apologize, even if you're not at fault. So let's say that a patient comes to you and he's angry that nobody's attended to them for the last 30 minutes or something. So you could start off by validating their perspective and say something like, I'm sorry for the inconvenience that this has caused. Or let's say the patient's pain is very high and they're agitated. And you could say, I'm sorry that your pain is so high. Or let's say somebody is angry that they haven't been given adequate attention so far. So you could say, I apologize that you've had to wait for so long. Doing so demonstrates that you've taken it upon yourself personally to resolve their concern and query, and it will also reassure them. Now the next one is right away. Now in a lot of cue cards, I've observed that the patients have concerns and they need a sense of reassurance. They need reassurance, they need a sense of immediacy, especially if they're angry about something where a treatment or attention to them might have been delayed. So using phrases like right away, I think this just signals that you are prioritizing their concern and that their concern is valid and it's relevant, and you are doing your best to resolve it and trying to speed up the process. So one example I can give you is, I can recall a cue card where the patient was angry, a patient admitted in the hospital who had rang the buzzer, but I think due to critical patients, the staff could not attend or couldn't come earlier, which is why the patient was agitated. So this could have been used that I'll contact the doctor right away and let them know that you're in pain so they can prescribe some medication to relieve the pain. Or I'll make sure that the next time you ring the buzzer, we're here right away. Or I'll see to this right away. Something that provides that sense of immediacy, something that signals that yes, you're taking it very seriously, you're prioritizing this, and that the concern is very important to you. The next one is definitely. Now this is a positive word. I think if you just add this, it just kind of reflects that you have that you are committed to help them, that you're doing your best. So something like, I'll definitely make sure that your concern is shared with the doctor right away. So for conflict resolution, this is a very effective sentence. Absolutely. I think this is something that you could use to empathize as well when you're trying to convey that you understand what they're saying. I absolutely agree with you. Let's say the patient is reluctant to your advice. You can say, oh, I absolutely agree. Then certainly as well. This can be used to persuade the patients. I haven't added that to the list, but you could use certainly as well. Something like, if you make these changes, this will certainly help you in making a big difference to your health in the long run. Fantastic. This can be used to motivate your patient. Let's say you advise something and the patient agrees to give that a try. You could motivate them, just reinforce that they've taken the right step. They've taken a step in the right direction. So you could say something like, that's fantastic. I'm so glad to hear that. Then pardon me and forgive me, they can be used to clarify a situation. There might be occasions where the patient feels as though they've detailed their condition or symptoms, but yet you cannot quite grasp the situation, you cannot understand, or you need more clarification about something. So in those scenarios, you could use the following phrases: pardon me and forgive me. So rather than saying what or repeat it, use a more formal expression. So just say, "Pardon me, could you please repeat that again? Or could you paraphrase that? Or could you tell me that in other words? I wasn't able to understand it." Or "Forgive me, I didn't quite catch the last sentence. Do you mind repeating it for me?" So these are some basics which we are aware of, but sometimes we tend to overlook them. We don't use them under the pressure of the exam. So I'd like you to make sure that these are incorporated wherever appropriate, and they will help you in improving your score for the relationship building criteria, and you will demonstrate a respectful attitude towards the patient.
Hi, I hope you found the video useful. Like this, we have skill lessons for different topics like reassurance, empathy, questioning techniques, persuading the patient, and so on. If you're planning to take the exam and you want to enroll with us, please contact us at 98723 19935. We look forward to hearing from you.